Good afternoon. I am pleased to introduce you to McKesson's brand new chiropractor templates. Our agenda will provide you with a brief overview of these templates. Our chiropractor customers using our templates will be able to efficiently and easily document the treatment of common chiropractic complaints such as neck and lower back pain. Achieving and maintaining maximum patient volume is critically important to many chiropractors. Speed is the key here, as it is of utmost importance to emphasize speed when demonstrating these templates. Our demonstration starts with a brand new patient, Sam Tanner. Our medical assistant has already documented chief diagnoses established by Sam's family care provider, specifically asthma and diabetes type 2 control. Also, our medical assistant has documented Sam's allergies and his one and only medication, ibuprofen 600 milligrams. As we begin the documentation by selecting our template, you can see the various templates that we're offering, such as headache and neck pain, including their appropriate follow-ups. Since Sam is a new patient, we will select our initial assessment template. As you might imagine, with any brand new patient, there's a lot to document. We might as well get started now. Where we indicate the presence of pain and stiffness, the absence of numbness and weakness, where the pain is located in the neck and not in the arm or leg. Onset occurred starting 1 to 2 weeks ago. The patient would describe the nature of that pain as dull, quality as being achy, where severity on a scale of 1 to 10 will be rated on a 5 of 10. Actually, I'm going to increase the magnification so that it's easier to be seen on screen. Alleviating factors, the only thing that helped to alleviate was analgesic medications, heating pads, and stretches. Everything except for rest seemed to exacerbate the pain. Past medical history, Sam has indicated that he has not been the recipient of any neck pain or injury, back pain or injury, has not received prior medical testing or treatment for this problem. Sam indicates to us that he exercises regularly and currently works full-time as a cashier. He seems to eat well, according to him, doesn't smoke, doesn't drink, doesn't use illicit drugs. Due to this pain, does show some signs of depression. Sam does not have a family history of hypertension, high cholesterol, or coronary artery disease, but just like him, he does have a family history of diabetes, but no presence of colorectal cancer, alcoholism, or mental health issue. Review of systems is full negative. And as we begin to document our red flags, we can see that the patient has not been involved in any trauma or strenuous lifting, is not over the age of 50, does have a history of cancer in his family, no recent fever, chills, or weight loss, no recent UTI, no IV drug use, no immune suppression, and pain that does not worsen with supine positioning or severe night pain. Negative Takeda equina syndrome. And as we begin to document our physical exam, it's full normal, so we can easily document that. And as we document the range of motion in his back, we'll simply indicate that upon flexion he had 45 degrees range of motion, extension 60 degrees range of motion, lateral rotation at 70, lateral bending at 30 degrees. Special tests were all negative except for the Betz-Churus test. Testing for sciatic tension at the sitting knee extension was negative. No pain in either the left or right leg upon raising. and no evidence of exaggerated pain behavior. When the patient initially presented to the clinic, our front desk staff presented him with the Oswestry Low Back Pain Disability Index, which he scored at 21 to 40%, which indicates moderate disability. And as we select our assessment, we will select lumbosacral sprain and strain, lumbar sprain and strain, and lastly, muscle spasms. Our plan will include spinal manipulation, 1 to 2 regions, mechanical traction, and therapeutic activities. Our patient education, we indicated that there was no hint of a dangerous problem. He should recover pretty rapidly. And we are going to apply lifting limits for a male. Ask that he avoid lifting more than 60 pounds. We're going to have him follow up in 3 days, sooner if pain worsens. At the end of the template, we have various links pointing to various documents. If you remember above, one of the things that indicated the patient completed was an Oswestry Low Back Pain Disability Index. It normally consists of the patient filling out a form, a questionnaire really, where based on the patient's responses to the questionnaire determines his score at the end. And you can see here how we can incorporate some of those different forms for the patient to complete. We'll go ahead and sign off on the document where we have a recommended E&M value. One thing to note is that many chiropractors do accept cash and are oftentimes a cash-based practice. So in those instances, an E&M value is not going to be necessary since they're not sending the claim for a cash-based customer or patient. We'll go ahead and electronically sign off on that document. And lastly, of course, through our BrightNote technology, you'll see the synchronization of information to the different areas of the chart, including the problem list and procedures on that list as well. So you can see the spinal manipulation, the traction, and the therapeutic activities, the resulting diagnoses codes and CPT codes created in electronic encounter form with a display of those codes present. So you can see we have the screening for alcoholism, the sprain in the lumbosacral area of the back, the sprain in the lumbar region in the back, the muscle spasm, and the various codes for the procedures that we did in-house, and the 99202 E&M value. What we've just seen is a brief overview of our chiropractor templates. The completion of probably the most comprehensive of our chiropractor templates, the initial assessment. And from that initial assessment, the completion of the note, how BrightNote distributed the information, primarily the diagnoses and the procedures to the chart, including the creation of an electronic encounter form. Thanks for your attention. If you have any questions, please feel free to refer to our chiropractor documents, and have a great day. Thank you.